Here are 50 scenario-based nursing home interview questions, along with detailed sample answers to help candidates prepare effectively. These questions focus on real-world situations, critical thinking, patient care, communication, ethics, and teamwork, which are vital in a nursing home setting. Resident care scenarios. 1. The resident refuses to take their medication. What do you do? I would first try to understand why the resident is refusing. Is it fear, discomfort, or confusion? I'd calmly explain the medication's purpose and benefits. If they still refuse, I document the refusal, notify the nurse in charge or doctor, and monitor the resident closely. 2. A resident is suddenly confused and agitated. What actions do you take? I'd assess for possible causes: UTI, low oxygen, hyperglycemia, pain. I'd ensure their safety, speak calmly, and alert the RN or physician. Prompt documentation and communication are essential to manage the condition appropriately. 3. How do you manage a resident with dementia who keeps wandering? I'd redirect them gently and calmly, avoid confrontation, and ensure they're in a secure environment. If needed, involve the care team to assess for triggers or unmet needs, and adjust care plans accordingly. 4. A resident falls. What are your immediate steps? Check for injuries without moving the resident unnecessarily. Call for help, ensure safety, and provide reassurance. Notify the nurse, assist in documentation, and help implement fall prevention strategies. 5. What would you do if a resident accuses you of stealing? Remain calm and professional. I'd assure the resident that the concern will be addressed seriously. I'd report it to my supervisor, document the incident, and cooperate fully with any investigation. 6. How do you deal with a resident who frequently complains? Listen empathetically and avoid being defensive. I'd validate their feelings, investigate their concerns, and act or escalate appropriately. Ongoing communication and care plan adjustment may help resolve frequent complaints. 7. A resident is end of life and non-verbal. How do you provide care? Focus on comfort, manage pain, moisten lips, requisition for comfort, and create a peaceful environment. Communicate gently even if they can't respond. Support family members as well. 8. What if a resident wants to eat but is NPO, nothing by mouth? I would not provide food and explain gently why it's not allowed. I'd offer comfort, like a moistened sponge, and notify the nurse for further guidance or clarification with the resident or their family. 9. You notice a resident is developing a pressure sore. What do you do? Report it immediately to the nurse, document the area, and assist with implementing preventive strategies, frequent repositioning, pressure-relieving devices, skin care, and nutrition support. 10. How do you handle incontinence in a dignified way? Ensure privacy, use respectful language, act promptly, and clean gently with appropriate products. Encourage toileting schedules if possible and monitor for skin issues. Teamwork and communication scenarios. 11. A co-worker is repeatedly late and it affects your work. How do you handle it? I'd first try to talk to them privately and respectfully. If the issue persists, I'd report it to a supervisor rather than let it affect patient care. 12. A nurse gives you an order you believe is incorrect. What do you do? Clarify the order politely. If still unsure, consult another nurse or escalate to a supervisor before acting to ensure resident safety. 13. You overhear a co-worker speaking disrespectfully to a resident. What do you do? Intervene calmly if safe to do so, comfort the resident, and report the incident to a supervisor. Abuse or mistreatment must be taken seriously and documented. 14. You are overwhelmed with tasks during your shift. What do you prioritize? I prioritize based on resident safety and clinical needs. First, emergencies. Then time-sensitive tasks like medications, followed by hygiene or comfort care. 15. How do you respond to a family member who's angry or upset? Stay calm, listen actively, acknowledge their concern, and avoid arguing. I'd provide what information I can and refer them to the nurse or manager if needed. Ethics and professionalism scenarios. 16. You accidentally give the wrong meal to a resident. What do you do? Stop them from eating if possible, report the incident, check for allergic reactions, document it, and participate in any corrective measures. 17. A resident confides they feel depressed and don't want to live. What do you do? Take the comment seriously. Provide emotional support. Notify the nurse or mental health professional immediately. And ensure the resident isn't left alone. 18. How do you handle confidential resident information? I follow HIPAA guidelines. No discussing resident info in public. Only share with authorized personnel. And secure written electronic data properly. 19. What if you disagree with how a colleague handles a resident? I'd assess whether it's a safety or ethical concern. If so, I'd report it. Otherwise, I might approach the colleague respectfully or discuss the issue with a supervisor. 20. You witness another caregiver falsifying documentation. What do you do? This is a serious issue. I'd report it immediately to a supervisor or compliance officer and document what I witnessed. Falsification is a breach of ethics and patient safety. Time management and prioritization. 21. You have 5 call lights on. What do you do? Assess quickly. Prioritize life-threatening needs first. For example, breathing, bleeding, then assist based on urgency. Communicate with co-workers to divide tasks if possible. 22. You're assigned more residents than usual. How do you manage? I stay organized, use a task list, prioritize based on clinical needs, and ask for help from the team if needed. I maintain communication with the nurse for any concerns. 23. What if you're asked to do something outside your scope? I would politely decline and explain it's outside my scope of practice. I'd notify the appropriate staff member to ensure the resident still gets the needed care. 24. You're at the end of your shift, and a resident needs urgent help. What do you do? Resident safety comes first. I'd assist the resident, then give a proper handover to the next shift and document the incident. 25. You forgot to chart a care task earlier. What do you do? I chart it as a late entry, clearly indicating the actual time it occurred, and follow facility policy. Honest and accurate documentation is crucial. Resident and family interaction. 26. How do you calm an agitated family member demanding to speak to the doctor? Listen respectfully. Explain the doctor's availability, and offer to pass on the message or connect them with the charge nurse. Remain professional and empathetic. 27. A resident with dementia believes they need to go to work. How do you respond? I'd validate their feelings and redirect them with a calm approach, perhaps suggesting an activity or walk. Avoid arguing or correcting them. 28. How do you handle cultural or religious preferences that affect care? Respect and accommodate when possible. I'd ask for clarification, follow care plans, and involve family or cultural liaisons as needed. 29. A resident refuses to bathe. How do you handle it? Understand the reason. Fear, modesty, pain. I'd offer alternatives, for example, sponge bath, schedule for later, or involve a team member the resident trusts. 30. How do you support a grieving resident who lost a roommate? Offer compassionate presence, listen if they want to talk, and report emotional distress to the nurse. Grief support may be needed from chaplain or counselor. Emergency response scenarios. 31. You find a resident unresponsive. What do you do? Check responsiveness. Call for help. Initiate CPR if trained and appropriate. Follow emergency protocol. And stay with the resident until help arrives. 32. A fire alarm goes off. What do you do? Follow race protocol. Rescue, alarm, confine, extinguish. Move residents to safety. Close doors and follow facility procedures. 33. What do you do if a resident has a seizure? Keep them safe. Remove hazards. Don't restrain. Turn on their side. Time the seizure. And notify the nurse. Monitor and comfort after it ends. A resident is choking. What's your action? Assess severity. If they can't breathe or speak, perform abdominal thrusts. Heimlich. Call for help and document the incident afterward. 35. A resident has a nosebleed. What do you do? Sit them upright. Lean slightly forward. Apply pressure to the nostrils. And notify the nurse if bleeding persists or worsens. Behavioral and psychological scenarios. 36. How do you respond to a resident who is yelling at you? Stay calm. Don't take it personally. And try to identify the cause. Pain, frustration, confusion. Give them space, de-escalate, and report if needed. 37. A resident refuses to engage in activities. What do you do? Respect their wishes but encourage gently. Learn their interests and work with activity. Staff or family to offer alternatives they might enjoy. 38. How do you support a resident who is crying often? Sit with them, offer comfort, and listen. Assess for depression or emotional pain. Report to the nurse or social worker for further intervention. 39. A resident is sexually inappropriate. What do you do? Set firm, respectful boundaries. Ensure your safety and dignity. Report the incident and have care plans updated to address the behavior. 40. A resident believes you are their child. How do you respond? Avoid correcting them directly. Engage in their reality if safe to do so. Redirect gently and provide emotional support. Long-term care best practices. 41. How do you contribute to a resident's care plan? By observing their needs, preferences, and changes and reporting them. I communicate with the care team and advocate for the resident's well-being. 42. How do you ensure continuity of care during shift changes? Give clear, concise handoff reports, including any incidents, behavioral changes, or ongoing needs. Documentation must be thorough and timely. 43. How do you promote independence in elderly residents? Encourage them to do as much as they can safely, like grooming or feeding. Offer help only when needed and praise efforts to build confidence. 44. How do you support infection control in the nursing home? By practicing proper hand hygiene, using PPE correctly, cleaning equipment, and following isolation protocols when necessary. 45. A resident with Alzheimer's keeps asking the same question. What do you do? Answer patiently each time using a calm tone. Repetition is part of the disease. I'd redirect when possible and maintain a supportive environment. 46. A resident is withdrawn and not eating. How do you respond? Observe for depression or illness. Encourage them gently, offer food choices, and report to the nurse for further evaluation. 47. A resident has a new roommate and is unhappy. What do you do? Listen to their concerns. Help mediate differences respectfully. and report to the nurse or social worker for room change evaluation if needed. 48. How do you encourage fluid intake in residence? Offer fluids frequently. Provide favorites, juice, flavored water. Track intake, and involve family or dietary staff if needed. 49. What would you do if a resident hit you during care? Ensure my safety. Step back and assess the cause, confusion, fear, pain. Report the incident, document it, and work with the team to adjust the care approach. 50. What is your approach to person-centered care? I learn each resident's preferences, values, routines, and life story. I involve them in care decisions, respect their choices, and provide compassionate, individualized care.